Hello. So if you can tell from the title of this video, I'm here to talk about my recent transphenoidal surgery for my pituitary macroadenoma. It's a lot of big words, but basically, I had the surgery about a month ago, and I was actually prepared to film this video immediately after surgery because compared to what I had read up on and people's experience and description of what it was like afterwards, I was completely fine after surgery almost immediately. I was shocked. I thought there would be tons of pain and it would be quite the recovery, but honestly, I look and sound almost fine. I do sound a little bit blocked up like I have a cold, but that's because there's a contraption or device implant thing in my nose at the moment, but I'll get to that. I'll start from the beginning, I guess. If you watched the video before this, I did a video explaining essentially how I ended up getting diagnosed with the pituitary macroadenoma and the acromegaly diagnosis. So I'll just dive into a little bit about my symptoms and test results and what led them to decide that transphenoidal surgery was the right thing for me. So I had a pituitary apoplexy, so it's a hemorrhaging of the pituitary tumor. That led them to want to look at it urgently because obviously hemorrhaging, not good. We don't want that. And they wanted to make sure that because of the hemorrhage, they were concerned that my pituitary gland might be damaged because at the time, even though I was already sick before I had the pituitary apoplexy, the hemorrhage of the tumor, I had been more sick following that hemorrhage. So before the hemorrhage, it was basically, really terrible fatigue, horrible pain 24/7 in all my joints, my hip being one of the worst, but every joint basically hurt, my hands basically useless, always in pain, and constant headaches. My hormones were out of whack. I had thought that it was because I'd had two pregnancies, one in 2020, one in 2022, and I just had all these imbalances. Like all of a sudden my period wasn't as regular as it used to be, as well as it was way heavier. It would cause crazy cramping, which I'd always had before because I had endometriosis, but it was just a horrible amount of pain compared to prior to the pregnancies. Non-stop headaches. I was taking at least 6 ibuprofen a day in consultation with my rheumatologist. I had pain in my face from constant colds and then COVID, and it just always hurt in this kind of region in my face. And I kept getting teeth infections. Well, they said gum infections at the back of my mouth over the past couple months, and it was just randomly occurring. It's very bizarre. And so all those things are happening. So I had excessive sweating, crazy hair growth, acne, and I'm nearly in my 40s, so haven't had acne issues since puberty. So all of those things have been problematic for the past 5 years for sure. I've been feeling terrible for about 10 to 20 years. But all my tests kept coming back normal for the stuff that they were testing me for. So my iron levels would claim that they looked fine, but it wouldn't. My fatigue obviously was not fine. And so all these tests that I had done over the past 2 decades, but in particular over 2023, I had a whole year of just constantly trying to go for ultrasound. So they'd done ultrasounds and MRIs of my chest, of my neck, of my spine, of my hip, because everywhere I kept saying was hurting. They could see inflammation, but they couldn't see any real cause, and they had diagnosed with ankylosing spondylitis. So anytime I complained about fatigue or pain, issues with movement, they would say it was because of that. That's now considered to be a misdiagnosis, and it was actually acromegaly all this time. So fast forwarding to 3 months ago when I had the pituitary apoplexy. So basically felt like a brain explosion in my head, as I've explained in a previous video. I got an MRI done, and they found the pituitary macroadenoma. And the thing for my pituitary macroadenoma is when you get diagnosed with a pituitary macroadenoma, there's a couple things you can do. You can either do nothing and just keep an eye on it and see if it's causing any symptoms, because if it's not secreting anything, no bad hormones or excessive hormones of some sort, then technically it's just a blob sitting there, not technically doing anything. It's not pushing on your optic nerve, it's not pushing on your pituitary gland, it's not, moving upwards toward your brainstem. So it could technically just stay there, and you can hope that it doesn't hemorrhage like mine did. Mine hemorrhaged though, and in doing that, my symptoms escalated. So before I was tired, now I was basically broken. After the hemorrhage, I couldn't stay awake for longer than 3-hour stints. It was like my battery went out, and I just couldn't stay awake. It was really terrible. I started losing copious amounts of weight. So I was already pretty small to begin with, but I lost about 6 kilos in a month. So over 10 pounds in a month, and was eating the same. And so it was just, I was very thirsty all the time, was drinking a lot. And so they checked my IGF-1 levels, and my IGF-1 levels were wildly elevated. And so I think the range from memory is something like between 0 and 39 as normal. And mine was like 59 or something like that. And then immediately after the surgery, it went down to 38. So the highest of the normal end, but still obviously like 20 milligrams. I don't know, whatever measurement that is. And so my IGF-1 levels were very high, and because of that, they formed the view that either the MRI was wrong and the tumor was actually secreting excess amounts of growth hormone, or that the tumor, because it was touching the pituitary gland, was compressing on the pituitary gland and causing it to release excess hormone, or that the hemorrhage had hit the pituitary gland and damaged it, causing me for it to be producing, again, excess levels of growth hormone, IGF-1. So because they couldn't determine which one of those scenarios it was, but ultimately something was causing my IGF-1 levels to be so high, I was recommended to have transphenoidal surgery ASAP, which I was happy to do because I was so ill and very, very tired of, tests saying that everything looked normal, because it definitely did not feel normal. And so I was just very keen to feel better. And so basically the process involved quite a few different specialists, because there's a bunch of coordination with an ENT, because they do the surgery for mine in particular, since it was where it was, and because of the access, they could go through your nose instead of having to do a craniotomy. So because they could do the transphenoidal surgery, you have an ENT who basically directs the device, I don't know what it is, thing through your face. And so they drill through something that's at the top of your nose to get access into this area. So it's, like I said, it's behind the optic nerves, and then in front of the pituitary gland at the base of your brainstem. So it's basically somewhere back here. So they're going through your nose. They drill through here on the inside, and then basically like take out the tumor bit by bit through your nose. So we had an ENT, endocrinologist, the neurosurgeon. Obviously, the neurosurgeon does the actual surgery after the ENT enters the area for them, I guess. And then the anesthesiologist, and more people that I'm sure I'm forgetting. I had an optometrist because they obviously are very concerned given the location. I had an ophthalmologist looking at whether or not there's any loss of periphery vision, because that's also one of the signs that it's compressing against your optic nerve and impacting your eyesight. Luckily, I did not have that, but that is one of the signs. Bear in mind if you have any loss to your periphery, they will take that as the tumor is compressing that optic nerve. But again, mine seemed to be compressing the pituitary gland. So we went in, my husband and I went in for the surgery, or went into the hospital for the surgery around 5 a.m. By 7 a.m. after doing all the pre-op tests, and there are many tests. My arms, I think I have pictures of all the like veins that I blew and all the tests. I think my arms were covered in bruises, my legs were covered in bruises, and yeah, just I cannot tell you how many how many needles and blood work was involved. If you have a problem with needles, I'm sorry in advance, but it, compared to how awful acromegaly is and how much pain you're in, to be quite honest, most of it didn't even register. I was just kind of like, whatever, just take whatever blood or insert whatever medications you need to insert, because it was just compared to how awful I felt for so long, having bruised arms and legs and tons of blood work done was the least of my problems. So you go in for the surgery. Like I said, we got there at 5 for the check-in at 6 for all the pre-op blood work and testing and whatnot. By 7 a.m. I was being wheeled in, and as far as I know, because again, I was not conscious, so I don't know, but as far as I know, I think around 8 a.m. or 7:30 a.m. they started the surgery, and I apparently, and the surgery is meant to be around 3 to 5 hours. Mine was around 5 hours, and I was put in recovery around 1 o'clock. There were no significant issues or complications with my surgery other than the fact that I had a very concerningly low blood pressure and was wildly dehydrated, so they ended up keeping me in a recovery room in the ICU for a couple hours. And so my husband said that he finally saw me at 3 o'clock, and apparently I just kept telling anyone, including him, anyone who would listen, that it was amazing and that I wasn't in pain. And I do remember that. I remember waking up expecting a lot of pain. Like, I thought it would feel like someone had drilled through my face and I thought it would feel like, you know, a headache from hell. I thought I would be in copious amounts of pain, including my normal pain everywhere, and I felt nothing. I will say that that first day of the surgery itself, I was given fentanyl. So that first day was the only day that I had pain medication. So fentanyl was given on that first day, and I was pretty much asleep that first day. They wake you up every hour for observations, so you can tell them your name, where you are, and do blood work and do testing and blood pressure and all those kinds of checks. So I was asleep, but being woken up quite frequently for safety reasons, obviously. So the first day, like, definitely no pain, but obviously fentanyl might have assisted with that. And then after that, I wasn't aware of this, but you could just ask for pain medication if you need any. I didn't ask for any, but it's because I didn't need any. From day 2 onwards, I was wandering around. They took out the catheter that was in me on day 3 because I did have issues with extreme thirst following the surgery, which is one of the things they look out for, because diabetes mellitus is something that can develop with IGF-1 growth hormone excess levels with acromegaly. I had been tested for diabetes prior to the surgery, and I did not have it. However, I had felt like I was reacting to excess sugars for quite a long time, so I had really reduced the amount of sugar, and so technically it was almost diet controlled. My insulin was working correctly, but it was I was still very, very thirsty if I had any kind of sugar, and I had to pee almost immediately. That got about 1,000,000 times worse after the surgery, and so I'd have like 4 liters of water per day. So you can imagine my catheter was very busy, and so because they had to monitor how much was going into my catheter, how much I was drinking, and test, you know, the urine for whatever they were testing. I had my catheter in for 3, almost 4 days, I think. Ultimately, they decided that it was borderline, but it could be managed. And so instead of drinking excess amounts of water, they had me start, you know, chewing on ice and things like that, because it was technically a combination of dry mouth. And so I wasn't actually thirsty. I was just trying to tackle the dry mouth that you get, obviously, from the fact that your nose is blocked and your mouth is hanging open all the time. And so it's quite easy to confuse thirst with dry mouth. And so they had me just try and see if I could like curb the drinking a bit, and just try and quench my thirst or dry mouth with something else. I ended up getting dry mouth spray. Highly recommend that. If you're going for the surgery, the dry mouth spray was extraordinarily helpful, because that really helped me get my excessive water drinking under control, because then I finally felt like I had some relief from the dry mouth sensation. And then pain-wise, like I said, I didn't even have a headache, like no headache, no pain. My face was quite bruised, like my nose was painful to touch, but I just didn't touch my nose then, and that wasn't a problem. My face at first was painful to touch, but that went away within a couple of days. The sinusitis pain is gone, and that happened immediately. All my joint pain, gone. That happened immediately. Carpal tunnel pain, gone. I do have occasional twinges, and I'm a month out now, so I do have occasional pain still here, but not nearly. Before I used to wear a splint nearly all the time. And in terms of headaches, not really many headaches anymore, and I used to have them daily. In terms of the crazy excessive sweating and acne, that's pretty much all gone. My face was very greasy before, and now it's back to normal and dry/normal. It's my tongue is all the things that had swelled up. So my feet are still larger than they were. So they've gone up 2 sizes, but now they've gone down 1 size. So the inflammation in my feet went down. My inflammation in my hands have gone down a little bit. My hands are still bigger than they were prior to being diagnosed with acromegaly, but the swelling, my rings were quite tight, and now they're normal. My tongue no longer feels like it has to hang like this out of my mouth. It feels like it fits in my mouth. So that feels like the inflammation of that has gone down. My nose felt like it had gotten bigger, and it had. Right now, I still have the contraptions. They have this thing that's like they call an implant. I don't know, implant of what? Something silicone or plastic, I can't tell. That's in your nose. It's very large. So that's causing the size of my nose right now. So my nose is probably going to be something closer to this once this thing is taken out. So you can feel it, you can see it. They're like 2 giant tubes, basically like plug it. Like they can't put a bandage obviously in your head here, so they have to stop like the blood from like pouring out, and there's worries about CSF leaks, cerebral spinal fluid leaks and stuff like that. So they have this to basically help the healing process. That comes out for me in 2 weeks, so I'll do another video after that. This video is getting really long, so I'm just going to stop it there. But basically, transphenoidal surgery for me, massive success. If you are eligible for it or considering it, I highly recommend it. The changes for me were basically immediate, and the recovery for me is going really well. Fatigue is the only thing that I'm still dealing with, and I'll go through all that in another video once I have, you know, more testing done. I have quite a few tests each week and still up ahead for the next month. And so once I get more information about my cortisol levels, which is one thing they're keeping a close eye on, I'll have more information about what future medication and recovery looks like for me. But so far, 1 month out from the surgery, so good. Doing really, really well. And fatigue is basically the only thing I'm still dealing with, but it's starting to improve. So, and just to not have pain, ugh, life is a million times better. So hopefully, if it was this good for me, it will be for you too. And if there's any questions you have, feel free to comment down below, and I can definitely try and answer it in the next video when I talk about the recovery process, maybe 2 months onwards or whatnot, once this thing is taken out of my face. All right, thanks for watching. Bye.